Good afternoon. My name is Bootyin Alice Peter, a master's student with the Department of Public Health, a student of JPTS Institute of Management Science and Technology, in collaboration with Pan American College, California, South American University, USA, Global Wealth University, TOGO. I am here to present a brief seminar on the topic Health Policy, Politics and Social Justice. Health policy is sometimes termed as a vision for the future, or it can be seen as an overreaching principles which are set in order to guide the practices and how a healthcare is to run. Health policy helps in formulating those rules and regulations, those do's and don'ts in the healthcare system. Health policy can also be seen as a guide in every healthcare setting. Health politics, in the other way, can be seen as the involvement of government and political office holders in the funding and running of the healthcare system. While social justice can be seen as a way in which the health services are being distributed among citizens of a particular country. Therefore, if we are marrying these words together, we will see that politics have a great influence on health policy. Because who are the political office holders? They are the government. And who set rules for every country or nation? They are the government. So so the political office holders are now are the ones responsible for setting health policy or those goals that are aimed to be achieved in the healthcare system. And also, if these political holders involve or they show partiality in the recruitment of the healthcare personnel, since that is one of their responsibility, that brings us to the issue of social justice. And this is refers to injustice in the health system. And also, when the political office holders are given more priority when it comes to healthcare delivery system, that is also an inequality in the healthcare system. Therefore, for the effectiveness of every healthcare or the public health, there should be an equal distribution of healthcare services among individuals. Health policies can also include economic healthcare, which is the financing aspect of the public health, whereby, like for instance, in Nigeria, government government fund all the government hospitals or the healthcare system that are run under the government. And also we have other private organizations that are also responsible for the funding of the healthcare system, such as the NHIS, which is the National Health Insurance Scheme. We also have private sectors, such as non-governmental organizations, funding the healthcare system. We also have another health policy, such as the medical research policy. These are policies that are guiding research in the healthcare system. We have so many research institutions. For instance, in Nigeria, a research institution owned by the government, like National Veterinary and Research Institute, NVRI, which is responsible for carrying out researches of new diseases and how to also provide vaccines in order to prevent some certain communicable diseases. This is a government institution, it's run by government, and people that work in such institutions are also employed by the government. So now we see that if political holders are being biased in such organization, whether you are qualified or not, as long as you belong to their class or political affiliation, you will be employed. And this have a negative effect on the health system. We also have health policy like global health policy. Global health policy have to do with the policy that safeguard the health of the world entirely. And the bodies responsible for this include the World Health Organization. And if you see in the global health policy, Some countries are giving more priority, especially the developed countries tend to be more advanced or are giving more attention than the developing nation. And doing that will affect the health system. Thank you for listening.